My name is Dalelkanova T D, and I am an assistant of the Department of Children's Infection Disease. And today I want to demonstrate to you my lecture about enterovirus infection in children. Plan of our lecture is included these questions which you see about definition, etiology, epidemiology, clinical manifestations, treatment, diagnostics, and prophylaxis of this disease. At first, enterovirus infection is one of the widespread infection in the world, which occurs mainly in children and young age peoples, and there has a variety clinical manifestation due to the lot of pathogens. Enterovirus infection is an acute viral infection disease which caused by intestinal viruses like E. coli, Coxsackie A and B type, and human enteroviruses 68-71 types, and ecoviruses. And the main mechanism of transmission is fecal-oral. Etiology of disease. Causative agents are viruses from the family of picornaviruses, from the Latin language. Pico means very small, RNA containing, and the viruses. And today we know about 67 pathogenic serotypes to human. From these 67 serotypes, 23 Coxsackie A, 6 types Coxsackie B, 3 polioviruses, 4 human enteroviruses, and other 31 are ecoviruses. And their virus contain single-strand RNA. This RNA is surrounded by icosahedral capsid, which contain 4 viral proteins, VP1 up to VP4. The main is VP1, and these viruses haven't external lipid envelope. And these viruses are stable in room temperatures. They're resistant to low temperatures, resistant to the acidic environments, but when boiling, they are died. Epidemiology, the main mechanism is fecal-oral, sometimes airdrop also. Factors of infections transmission, mostly contaminated water, dirty hands and the toys in children, and other environmental subjects. Susceptibility to infection is high, mainly happens in children, and the infection has seasonality, mostly summer and the early autumn season when weather is warm. Pathogenesis of enterovirus infection. Now, due to the fecal-oral transmission, pathogen will penetrate by the mouth, and the reproduction happens in the upper respiratory tract, in the nasopharynx, oropharynx, and tonsils. After that, by the fecal-oral route, infection viruses will move by GIT tract to the intestine. Their secondary reproduction happens in the Peyer's plaque. After that, to the blood happens primary viremia, when virus will spread to all organs and systems by the blood. And after that, we'll find their target tissue, and there will happen tissue damage. And what kind of tissue will damage depends on the types of viruses. For example, today knows like polio and Coxsackie viruses can damage brain, and meninges can cause encephalitis, paralysis, serous type of meningitis. Eco and Coxsackie A type can damage skin and the mucous membrane and cause famous form of infection called the HFM, hand-foot-mouth disease, and etc. Classification. As all other infectious disease, EVI classified by type to typical and atypical. Typical form can be isolated when only one clinical manifestation will occur, and combined when patient has 2 or more forms together. Atypical form can be erased and inapparent. Inapparent mostly means when no clinical manifestations or signs will be atypical, and erased when duration of disease will be changed. By severity to mild, severe, and moderate, and by the course, it's always acute, and there happens sometimes smooth and non-smooth, depends on the possible complications. First form of infection is the enterovirus fever, enteroviral epidemic fever. This form of infection characterized by acute onset by increase in body temperature up to febrile grades or 8 or 9 grades, and the duration of this fever up to 2 to 4 days, sometimes last 1 to 2 weeks. And second manifestations, mostly intoxication syndrome, which includes weakness, lack of appetite, headache, myalgia, and some patient has hepatomegaly. Next, and one of the most spreading in children form calls epidemic exanthema or Boston's fever, which characterized by increasing in body temperature up to febrile grades, and the patient has general intoxication symptoms like weakness, headache, nausea, and other signs, and on the peak or decreasing of the fever will occur spotty papillary rashes. And this exanthema mostly macular papillary character, and the localization are trunk, body of the baby, limbs, including the palm and feet, and mostly this form during this other form of infection which calls herpetic angina, herpangina, which characterized by lesion of the soft palate, and this form is famous like HFM or hand-foot-mouth disease. This is how looks these macular papillary rashes on the feet. Next form of infection, this is enteroviral herpangina or enanthema, which characterized by increasing body temperature and the appearance of the painful ulcers, papules, vesicles, and ulcers on the soft palate, on the arches, on the palatine arches, and which characterized by pain and the swallowing, sore throat. Also, small kids has increasing of the salivation, weak feeling, or irritable, and other intoxication signs. And after 2-3 days, fever will be reduced, and the duration of this form up to 6 to 7 days. Next form of infection is enteroviral serous meningitis. This form occurs when meninges will affected, characterized by acutely onset by increasing body temperature. Then patients will complain to the profuse severe headache, and on the peak of headache they has repeated vomiting and the possible occurring of the meningeal symptoms. Also, most of patients has other additional signs of hyperesthesia like intolerance to the bright light, like photophobia, intolerance to the loud sounds, phonophobia, hyperacusia, etc. And they has positive meningeal symptoms. In these slides for you demonstrated meningeal symptoms of the children. First of all, it's demonstrated stiffness of the neck or rigidity of the occipital muscles, and the next symptom is Kernig sign, lower demonstrated, and the Brudzinski upper, medium, and lower possible will be positive, and in infants we will also determine hemorrhaging or Lesage symptom also. Next form of infection also is spread in the children, called gastroenteric form, and the infection characterized by acutely onset, also by fever sense, then occurring of the dyspeptic syndrome. Most of patient has nausea, repeated vomiting, and abdominal pain without specific localization. After that, patient will have diarrhea, viral diarrhea, watery stool, from the up to 2 to 10 times a day, sometimes more, and duration of this form is prolonged up to 1 to 2 weeks. Next form of infection calls Bornholm disease or epidemic myalgia. This form of infection characterized by increasing body temperature and the occurrence of the pain syndrome, and pain characterized by the pain attacks which happen mostly in the chest and diaphragmal muscles, and pain attacks can last up to 10 to 30 minutes, and until the patient has difficulty breathing, sometimes apnea, and like these pain attacks can repeated in a day several times, then will disappear. Next form of infection is called polio-like or paralytical form of enteroviruses, which characterized by increasing body temperature and the violation of the child's gait, and the patient has weakness on the legs and arms, reduced muscle tones, mostly affected asymmetrical limbs, and the patient has mostly paresis, but these paresis will be passed quickly, and atrophy and skeleton deformities and contractures like in polio infection not happened. Next form of infection called encephalomyocarditis is one of the most severe and form of infection, and characterized by high mortality, mostly in newborn, happens and registered mostly in maternity hospital, and most of newborns will infected from the other medical workers or parents and relatives diabetes of the child, and characterized by very severe course when baby will have a fever, then general weakness, cyanosis of the skin up to acrocyanosis, and the expanding of the boundaries of the heart, systolic murmurs, and movement of the heart tones, focal change, and the persistent cardiac tachycardia, and needs emergency. Next form of infection called mesodermitis. Means inflammation of the mesenterical lymph nodes. They will swollen in size, increased by the size, and pressed to the abdomen, and the main sign is abdominal pain near umbilical zone, and most of people has meteorism, means flatulence, abdominal pain, sometimes vomiting. Duration of this form is long, sometimes lasts up to 1 to 3 months. Next form of infection, enterovirus hepatitis. This form mostly has the same clinical manifestation with atypical hepatitis A disease. Means most of patient has intoxication symptom and their dyspeptic symptom also, like nausea, vomiting, and diarrhea, and increasing of the borders of the liver. And in the LFT test, you can find slightly elevated of ALT, AST, but bilirubin level will be not changed, means patient has no jaundice and atypical hepatitis. Enterovirus hemorrhagical conjunctivitis. Mostly this form caused by enterovirus 71st type and Coxsackie A24, and characterized by inflammation of the eyeballs, swelling of them, hyperemia, by increasing of the lacrimation, and the hemorrhage to the conjunctiva, and also one of the severe form of disease, because up to this infection possible severe complications like atrophy or sub-atrophy of the eyeball and uveal cataract, and etc. Next form of infection is a parenchymal orchitis and epididymitis. Parenchymal orchitis and epididymitis happens in male. Usually disease proceeds in 2 stages. At first stage, patient has clinics of another symptom complex. For example, baby has HFM form, hand, foot, mouth disease. After 2-3 weeks after illness by any other form of this infection happens, inflammation of the testicles or ependema in boys, and characterized by pain, swelling of the scrotum, hyperemia, and you have to do differential diagnosis with other diseases also. Differential diagnosis of enterovirus infection mostly doing by several infection disease. First one by the rash syndrome. It's at first it's the measles. Measles we know is characterized by gradual appearance of the rashes and the 3 days of appearance of spotty papillary rashes and catarrhal signs. Next one is rubella, which characterized by mild intoxication and catarrhal signs and the appearance of the small spotty papillary rashes and occipital lymphadenopathy. Next infection is bacterial infection like scarlet fever, which characterized by small pointed rashes on the hyperemic background of the skin, and the tonsillitis syndrome, and this infection is bacterial. Next one is chickenpox. We know this is blisters and vesicular rashes will be. Next one, due to the appearance of rashes and the affected meninges, meningococcal infection also, you have to pay attention. Next diseases are meningococcal meningitis, mumps meningitis, tuberculosis meningitis, and the polio infection also. You have to do differential diagnosis. The basic and the mandatory diagnostics tests which you have to do in enterovirus infection include, first of all, is CBC, and on complement blood test there are no specific change, and urine analysis also. Specific lab tests for confirmation diagnosis to finding pathogen are PCR, polymerase chain reaction. The samples will be taken in all forms from the feces, in herpetic angina from the nasopharyngeal and oropharyngeal smears, in the meningitis cases in the liquor. Also, you will find RNA of enteroviruses. Additional tests included instrumental tests like ECG, doing MRI or CT scan, ultrasound of the abdomen, and the LFT test, biochemical test, also coagulogram, and depends on the clinical manifestation and indicators. Treatment. There are treatment included non-drug treatment and drug treatment. Non-drug treatment include a bed regimen due to the all fever period and the lacto-vegetarian diet also. Drug treatment include mostly symptomatical therapy. We used antipyretics like acetaminophen, means paracetamol, 10 to 15 mg per kg, no often than every 3 to 4 hours and no more than 3 days. Next one is ibuprofen, 5 to 10 mg per kg, no often than every 6 hours, no more than 3 days. Also, chloropyramide, 1 to mg per kg as a desensitization therapy, as known also like cetirizine, levocetirizine. And there are no specific antiviral drugs, but we can use alpha-2 beta human recombinant interferons by immunomodulation therapy, also in severe intoxication, desintoxication, intravenously therapy also. And antibiotics used only if patient has bacterial complications. If patient has polio-like paralytical form, the main goal of the treatment will be increasing of the motor function of the skeleton. There we can use drugs like prozirine, galantamine, and corticosteroids drugs. If patient has meningitis, the main goal of treatment will be, of course, dehydration. There we use mostly diuretical drugs like mannitol, osmotic diuretic, and the furosemide lobe diuretic, also corticosteroids drugs. Patients who has enterovirus infection must be discharged from the hospital after normalization all clinical and laboratory parameters. If patient has all forms of disease, it's not earlier than 10 days. If patient has meningitis, isolation must be last up to 21 days. Prevention route mostly include non-specific routes like doing sanitizing hands, washing hands properly with soap solution, and avoid the contact with sick persons, etc. Monitoring of the person who was in contact with enterovirus infection lasts mostly up to 10 days. And there are no specific vaccine against this infection due to the lot of pathogens. That's all. Thank you for your attention.